Well, good afternoon, everybody. How are you guys doing today? I'm doing fairly decent. I just wanted to do a video today because I'm going to give you an update on my latest scan, my latest CT scan. About 2 months ago, I started getting a lot of abdominal pain, and I wasn't sure why. I had this burning sensation in my gut, and it was pretty just relentless. It went on a lot, and it was especially bad at night. And I remember there was a couple of nights when I actually went to bed with a hot water bottle against my stomach, because remember the old-fashioned hot water bottles? Anyway, went to bed with a hot water bottle across my stomach because it was so painful. And then just after about an hour or so, just said screw it, and got up and had about a half a banana and a couple of Excedrin, and that took care of it. But I was starting to get kind of worried.
Well, did I also mention constipation? I know, TMI, but that was another problem. I was really constipated, and that gets to be very disconcerting, because then the thoughts start going through your mind. Did the RSO really work? Has the cancer spread to my bowels? Has it spread to my liver? You know, these are all the things that go through your mind, and you're just not sure.
So back to the internet I go for some further research. And I was also trying to remember, did I make any major changes in my diet? And I remembered, yeah, I did. Not major changes, but I started incorporating dandelion root into my daily supplements. Now, I drank the dandelion root tea, no problem, so I ordered some of the capsules. And it's something else, you know, dandelion is really good for you. And I remembered that time that I did the ackee berry, hearing that it was so great for you, and started taking ackee berry, and it just tore my gut up. So maybe the dandelion root was doing the same. So I eliminated the dandelion root from my diet, and lo and behold, my stomach calmed way, way down. And as far as the constipation was going, I started reading about everything that causes constipation, and one thing that just really jumped out at me was cheese. And I thought, I do a lot of cheese. I'm not a brick a day or anything, but since I'm not eating very much meat, I do fill in with cheese. So I thought, okay, let's see if we eliminate the cheese, what happens. So I eliminated the cheese, and that was the answer to that. However, I still thought, it's been over a year since I've had a scan, and maybe it's time to get that done, because then I was just starting to wonder, okay, I really need to know. I need to know for sure what's going on inside of me. So I thought, okay, I'll get a hold of Native American Health and talk to my physician's assistant, Christine Pallel. So I talked to Miss Christine, and she said, I can order an MRI for you. She said, and I can order a scan for you. But she didn't think that she felt qualified as, say, Dr. Bold in the oncology department at UC Davis, as qualified as he would be to understand the scan. And I said, well, I don't think I'm their patient anymore. They did release me to go back to Native American Health. And she laughed. She said, no, Linda. She said, you are still their patient. And she said, however, if they refuse or they put you off, she said, I will order the scan for you. And she said, or an MRI. And so that's on her advice. I went ahead and I called Dr. Bold's office. And I talked to his secretary, or I talked to the receptionist or the nurse or whoever she was, and she said that she would ask him about the scan and get back to me, and she did. She got back to me and she said, yes, he definitely will do a scan. He just needs to know where to send the order to. So I said, okay, I will find a place down here to do the scan. So I did. I found Northridge Imaging and got everything all arranged, and they wanted me to come in ahead of time to pick up the paperwork. I had an appointment with them, I don't know, on a like a Friday. I think it was Friday. And I had an appointment at 10:30 in the morning, and they said to come down, I don't know, the day before or so, and pick up the paperwork and get the barium drink that I needed to drink, because I had to not have anything to eat for 12 hours and then drink this barium, one bottle at 8 o'clock, one bottle at 10 o'clock, and then come in for the scan. And so that's what I did. And you know, the barium drink isn't bad. It's vanilla. And I was hungry. And so, you know, no coffee, no smoothie, no nothing. So I drank that vanilla barium, and it satisfied my hunger. Okay, so I'm in there. I've drank my barium. I'm on the table. I'm all ready to be him to put the attendant to put the dye in my, I guess they were going to put it in right there for the contrast, and he asked me if I was allergic to any medication, and I said no. And then I kind of thought for a second, and I told him, I said, however, I am allergic to shellfish. And he froze. He said, oh, well, he said, this dye has iodine in it, and if you're allergic to shellfish, it's probably the iodine in the shellfish. And he said, I need to go ask my supervisor about this. And he came back in a couple of minutes, and he said, no dye, we're just going to do the imaging, but it's going to be a little bit more difficult for your doctor to read it because it's not going to have the good contrast. Okay, so they told me down there at the imaging center that those images would be sent to Dr. Bolt's office on Saturday, the next day. So, okay, that I imagine that was done. And I had gotten a notification from UC Davis, an email, and there was new information in my chart. Well, I hadn't, I realized I haven't looked at my chart for a long time, so I open up my chart and I start going through the different little things that you can look at in my chart, and I found a scan that was taken, my last scan that was taken a year ago, last May or last month, and I started reading that, and I thought, I don't remember seeing this scan before. Did I find this before and look at it or not? And I really couldn't remember having seen it before. So I start reading it, and I notice that I have a small cyst on my pancreas in the area called the Unicate process. I don't remember hearing anything about a cyst or seeing anything about a cyst. Okay, that's interesting. And then I see that there's been a partial occlusion of my portal vein and my splenic veins, a partial to complete occlusion of my splenic vein. And that was something else I don't remember hearing anything about, or did I even see that scan? I don't know. I don't recall anything. And I asked Lou, I said, did Dr. Bolt talk to us about anything about a cyst on my pancreas or occlusion of my splenic and portal veins and what that might mean? And he said no, he didn't remember it at all. So naturally, I'm on the internet looking up occlusions of the splenic and that portal vein. That's not too good. If it is completely blocked, of course, no blood flow is going to be getting in, but it's very prone to thrombosis, blood clots. And they said there really isn't a whole lot that can be done. It's very common with pancreatic cancer, very common. And the only thing that they can do for you is give you blood thinners so that your blood doesn't clot. Well, I'm already taking the Hawthorne, and I take the CoQ10, and there's something else I take that is kind of, a blood thinner too. So, okay, I'm okay on that one. But there's nothing that really can be done about that. As long as the cancer's there, I would imagine there's nothing that can be done about that. And as for the cyst, oh, that's even better. Um, Nothing can be done about the cyst either. If it talked about two kinds of cyst. One is more of a thinner liquid, a clear liquid, and more as a heavier liquid inside of it. And they can go along for years with no problems, but they also can erupt like a cyst. And if it does, it's going to go into your abdominal cavity and cause peritonitis, like a ruptured appendix. Isn't that nice? But it's not super common that they do that. And so if you get like a really bad pain and immediately start getting a fever, because it can go into blood poisoning as well, so you get a big fever with it. So that's something to keep in mind on that. But up to this point, I did not know that I had those other things besides the cancer. Lord. So it was a good 3 weeks later before Dr. Bold's office got in touch with me. I called a couple of times and found out that he only came in on Fridays. He's only been coming in on Fridays since the great quarantine has been in place. And so that was what that was all about. So he did. He called me. They arranged for a video conference type call or a video chat. And even though I couldn't go to Sacramento, we could do this video chat. And so that's what we did. And he seemed like he was really happy to see me. Big old smile and very, very cordial. Not half as serious as he was. Okay, so he said essentially that my scan has not changed at all from the scan that I had done a year ago in May. It looked to be exactly the same. He said, but because of the lack of contrast, he couldn't see the edges of the cancer, of the tumor, and whether it shrunk or not, he's not sure. And also about the splenic and the portal veins, couldn't tell about the blood flow going through there because of the lack of imaging as well. So those were two things, but he seemed very pleased that nothing had changed. He said all my other organs looked absolutely fine. There was no cancer has spread at all. So Dr. Bold, he never asked what I've been doing. He did not ask. Maybe it's on my chart that I was doing the THC, but he didn't ask, and he really didn't have any suggestions. He just said he's going to order the MRI and see if he can discern a little bit more. Meanwhile, as long as the cyst doesn't rupture and I can get some blood through those portal veins, I should be fine because the cancer is not spreading. It doesn't seem to be getting any bigger. So I could probably go along like this for years. I don't know. Like I say, as long as those other things don't play into this, it is looking rather promising. So what he wants to do is do an MRI. He said he can get a better idea with an MRI, so we're going to do that. I'll find out a place down here. But the whole visit ended quite nicely, quite well. So, did the RSO work the way Rick Simpson said it was going to work? I don't know. It hasn't. I don't know about the apoptosis. I don't know how much smaller the tumor is than it was before. But did it do something? Oh, yes, I am sure it did. I know the CBD keeps it from spreading, and it certainly has not spread. And the containment of it is that's a very good thing. You know, because pancreatic cancer is a stubborn one. It is a stubborn one. So do I think the RSO is helping? Oh, yes, I definitely think so. So like I said, I'm just going to have to wait and see. I think the jury is still out on the RSO. But I do know that something has stopped that cancer from growing. And I'm betting that it is the RSO because I haven't done anything else so drastic that it would stop pancreatic cancer from growing. So we'll just have to wait and see. And on that happy note of waiting and seeing, on that happy note, I'm going to say goodbye and thank you for watching my video. And I'm sure that I will be keeping you up to date on what is happening with me and my pancreatic cancer and my RSO treatment. Okay? Alrighty. Bye-bye.